Let's go back to COVID-19 because governments around the world have been working hard to find vaccines to inoculate and protect their citizens against SARS-CoV-2, the virus that causes COVID-19. Many are eager to get the jabs to escape the lethal hands of the virus. So far, more than 1,050 have been killed in Ghana alone, with many fighting for their lives in hospitals. What many don't consider beyond the vaccinations is how the waste is disposed of. That can actually be a source of viral and bacterial infections. Well, Public Health Department of the Ministry of Health, School of Hygiene, Zoom Lion Medical Waste Team and the School of Public Health, Kolebu, have been working to safely dispose of the medical waste from the ongoing vaccination exercise in parts of the country. That work has started in the Ashanti, Bono, and Bono East regions, where infections are also on the increase. Let's speak to Head of Medical Waste Department at Zoom Park, Ghana, Engineer Senam Tenge. He joins us via Zoom. I'm grateful for your time.
Hello, good afternoon. Thank you for this opportunity too. Thank you.
First, share with us the importance of this waste disposal exercise.
All right, thank you very much. A good afternoon to your cherished viewers too. Yes, in fact, medical waste management is very essential in the waste management terrain. In that, looking at the current vaccinations that is currently ongoing, waste will be generated. And this waste is regarded as a potentially infectious waste. That is, if it is not well taken care of, it will cause infection to people. You can realize that the syringes or the needles that are used in giving the jabs, it comes into contact with the body fluid of the person being injected, that is the blood. So this implies that, for example, if the person is an HIV patient, the needle now becomes a potential source of HIV. So if this needle is not properly treated and disposed, it could be of high risk to anyone that is pricked by that needle. So with this current intervention of handling the vaccination waste, it implies that we are going to take all the needles, syringes, any infectious waste that is being generated from the vaccination, we take it through a process of treatment. Now, this process of treatment is what sterilizes the waste, after which it is taken into a machine called a shredder. This shredder grinds the waste in such a way that it becomes tiny, tiny particles. So it does not have the potential of causing any needle prick injury to anyone that comes into contact with it. So in such a way, you realize that the waste is safe for disposal. When you do this, the first thing that you've done is what? You've reduced the risk of spreading of infection to others. The other thing is that you reduce pollution. If I say pollution, the conventional ways of treating medical waste was to use incinerators. Now, these incinerators, research has indicated that it releases pollutants such as furans and dioxins into the atmosphere. These furans and dioxins, they are carcinogenic.
Engineer Tenge is with he's with one of the Zoom Park Ghana. They are working on waste disposal of the stuff that come out from COVID-19. Engineer Tenge, if you're back, tell me more about what you've been working on since you started.
Okay, so thank you very much. So what I was trying to say is that we take the waste that is collected from the various vaccination centers to a treatment plant that is installed at various points across the country. These treatment plants have ultramodern technologies for waste treatment, which involves autoclaves and the use of shredders. These autoclaves and shredders, they sterilize the waste and make it harmless before disposal. Now, this technology helps to reduce pollution that was being emitted by the conventional ways of treating waste, that is the use of incinerators. Some of the old government facilities, they have incinerators that they use for treating their waste. But these incinerators, research has indicated that these incinerators releases furans and dioxins, which are carcinogenic. into the atmosphere. This can cause health-related risks such as lung cancer to the persons that may be exposed to such pollutants. So with the use of the ultra-modern technologies that Zoom Lion has brought on board, it implies that this risk of releasing these carcinogens into the atmosphere has been totally eliminated. So this is what we are. So not looking at just vaccination waste, but we are also looking forward to all medical waste that is generated from across the country. And this is our aim or focus with this kind of intervention report.
So let's look at the scope. What's the scope of this whole exercise? Is it limited to vaccine waste or medical waste in general?
Okay, so with this particular exercise, our scope is limited to the vaccination waste currently. So what we do is that, one, we provide bins, color-coded bins and liners, to all vaccination centers. So these color-coded bins and liners will help with the waste segregation at those centers. Now, when the waste is generated and stored, we come around with a specialized truck, which is solely meant for the collection of medical waste. So this truck moves from one vaccination center to the other to pick up all the generated vaccination waste within the period. The truck then sends the waste to the treatment site where it is subjected to the various sterilization procedures before final disposal. So this is the scope within which we are operating for the vaccination.
I'm grateful for your time. Engineer Tenge is with Zumpa Ghana. They deal with medical waste disposal at our various hospitals.